Good evening. My name is Jim McGuire, your host tonight, and we have a very special show tonight about prescription pill abuse. It's a very dangerous thing that's ravaging the United States today. It's a very bad thing. And another name for the program is prescription for danger. In other words, if you get involved in prescription pills without the care of a doctor, you know, you're entering into a dangerous area for your own health and the health of your family and friends. So that's what the show is about tonight. Matter of fact, we just reached the anniversary about 2 weeks ago of this horrible robbery in Medford, Long Island, in a pharmacy, where an addict went in there and held it up, and 4 people were killed during the commission of the robbery. So it just gives you an idea of the length that people will go to get pills, these addicts. So it's a very serious problem. Well, we have a great panel tonight that's going to discuss this, and I'd just like to mention them now, and they'll introduce themselves. From Arms Acres, we have Dr. Frederick Hess. He's with Arms Acres Rehab. And we have Doreen Lockwood. She's with the Chemical Dependency Director at the Putnam Family Services. Doreen's here. And we have Joseph DiMarzo, the Director of Putnam County Youth Services. Joe is here. And Laura Slavinsky, she's with the Arms Acres. She's a regional coordinator. Laura's here. So, would you like to introduce yourself?
Oh, sure. Thanks for having us, Jim.
Oh, good.
Yeah, the prescription drug problem in the United States is really reaching epidemic proportions, and it's a tragedy, really, because a lot of regular people, you know, that had taken prescriptions that they believed were legitimate for, you know, years, find that they become physically dependent on them, and it's affecting all age groups. We're particularly worried about the adolescents, the 15 to 20-year-old group, and that's the group with you know, very low tolerances. They don't know what these drugs are. Even they'll take anything in the medicine cabinet, and it's a big danger to them.
Thank you, Doctor. Doreen, would you want to say something?
Yes, along those lines, after alcohol and marijuana, prescription drugs are the most widely abused drugs by adolescents. 1 in 5 teenagers report using prescription drugs, and the problem with that is 40% of those believe that they're safer than other illicit drugs, and that's not true. So that's why it's really important for us to be having this discussion.
Thank you, Doreen. How about you, Joe?
Yeah, I want to just be thankful that I'm part of this group. I think that we have a lot of intelligent people who are dedicated to the service. In addition to what Dr. Hess said about the physical addictions, I think there's a lot of psychological addictions. And hopefully today we're going to leave your audience with some information that will better educate them, that they can then use some of those tools to either prevent or seek some help and move forward.
Thank you, Joe. Nora, would you want to say something?
Thanks, Jim. Hi, Nora Slavinsky, Arms Acres. Thank you for having me here today. One thing I would like to add, and hopefully we'll probably discuss, is to also explore what some of our parents can do. They're already doing a lot to educate their own children about the concerns and the problems with prescription drug abuse. But also, in addition to that, and also hopefully we could touch on the dangers also of cough syrup, cough medicine as well. And there's a lot our youth and our parents are doing, and I think we can do a lot more too to keep our community safe.
Very good. Thank you, Nora. Doctor, I wonder if you could just give us a definition of what is prescription pill abuse. Could you tell us?
Yeah, abuse would be taking a medication in a way other than it was intended. The main problem that we're seeing is people take it for the original reason, say a back injury or a knee injury, and then after that injury is improved, the medication continues. And that's because at about 2 weeks of regular use, a person becomes physically dependent on an opiate. These are opiates that we're talking about for the most part, but it could also be tranquilizers like Xanax or Klonopin, and also stimulants like Adderall or some of the ADD meds. But I think the other abuse category is when you're taking somebody else's meds that they were not prescribed for. And that's unfortunately more common than you'd think, because kids will try anything they can find in the medicine cabinet. And so it's important to clean out your medicine cabinet when those prescriptions are done. And the fourth big abuse category is taking a legitimate prescription with alcohol or other drugs. that adds another level of danger in the multiplying the effect of the prescription drug.
I see. Let's say tomorrow morning, if somebody out there has a problem with their son or daughter, or even husband or wife, what could they actually do tomorrow morning? Maybe you could all say something. What could you actually do, Laura? What could a family do?
Well, I think if they suspect that there's a prescription pill problem, they can call myself at Arms Acres at 225-3400, or Doreen, any of us, Doreen's at 225-2700, and we will help identify if there's a problem and a concern. A lot of times what I find, what gets in the way of people reaching out for help is the fear that they're going to get in trouble. The fear that they might get arrested, the fear, the shame, and we could talk about the legal implications a little later, but they can call us and we can steer them in the right direction. Someone might need a detox. Somebody might need outpatient. We're here to help them decide and figure out where they need to go.
Jim, we
Yes, Doreen.
also have the United Way Community Resource Line in Putnam County, which is 211, and we also have a Putnam County Crisis Line, which is 225-2122, I believe.
1222.
1222.
In addition
Yes.
to that, the National Council on Alcoholism is a great resource for people in the community, 225-4646. You know, the first step that anyone can take to seeking help is recognizing that there's a problem. And a lot of time the family dynamics are that we want to keep this within our own family, we don't want our community to know, we don't want our neighbors to know, and that really is old-fashioned thinking. We need to reach out and help people. We need to have people be able to reach out without embarrassment and seek help, and that's the first step to recovery.
I like
Yes.
to piggyback on that, and Joe really hits a really good point. And sometimes there's like a pink elephant in our living room, and we all know it's there, but we just walk around this pink elephant and pretend that it's going to go away, and it won't.
Right.
It just gets bigger. And the other point I like to make, and maybe my friends and colleagues can add to that, is the parents, when they have a child with a substance abuse problem, specifically the pills, because they're so easy to get. It's hard to say this, but the parents, and I know Joe likes this too, the parents need to be parents and not the pal. Sometimes there seems to be this really difficult step to step up to the plate and say this is just not acceptable, and it can be life or death.
Definitely. One of the things Dr. Hess had mentioned earlier, and I think it's very important for parents to know, kids today are getting the prescription medication from their own homes or from their friends' homes. We don't monitor our bathrooms when friends are over using our bathroom. It's so easy to go into the medicine cabinet and to take one Vicodin, one oxycodone, one hydrocodone, or take two. None of us really do an inventory. And I think that families need to put them in a secure place, whether they have a lockbox or in a drawer or somewhere where it's just not for everybody to see. And then when they are finished with the prescription, if there are any left, that they need to dispose of it appropriately.
When it comes to like people who can't sleep, they take pills for sleeping, sleeping pills, anxiety pills. It seems to me that that's okay if you're having a problem, but how do they begin to abuse that? Do you want to say something about that? How does the abuse
really,
start?
when you take a medication once in a while, or even every second or third day, your body doesn't build up a tolerance to it. But when it's a daily use, then the tolerance slowly builds up. So within 2 to 4 weeks, the same dose of medication doesn't really work as well, if at all. And the buildup of tolerance leads to a higher dose. So instead of 1 pill, somebody takes 2. And it's whatever the target symptom is, whether it's a pain problem or a sleeping problem, so that it's natural to end up needing to take more and more of those pills.
Is that why they use alcohol sometimes? They use
Either
alcohol with it
before
also?
or after. I think if somebody is a daily drinker, that would just be another layer on top of the risk of the pills. But if somebody drinks to boost the effect of sleeping pills, for example, that could be quite dangerous.
Jim, it's so interesting. Our society has evolved into immediate gratification, and that there are many, many ways that people as alternatives to some of the medications they take. Medications as prescribed by a doctor are appropriate and used as appropriate, but we often misuse them, and abuse comes from misuse. But you know, we need to be more preventative, and we need to be more health conscious and stop thinking that the pills are a panacea for our lives, because that's then where the psychological addiction comes in as well.
Right, right, very good. I hear there's a big thing about over-the-counter drugs. Would you want to say something about that?
Well, one of the things I notice working in the field, and with Arms Acres, we have the inpatient and outpatient services for the adolescents and adults. But one of the things I notice is the problem with the cough syrup, the cough medicine, the dextromethorphan, which is the main ingredient in there, in high doses, right? Dr. Hess, can cause sometimes like psychedelic hallucinogenic effects,
Right.
much like PCP, correct?
Right.
And sometimes just that alone can do it, but then most of the time kids are mixing. They're either high on marijuana, or they're drinking, or something else. So now you have all these drugs in their system, and it's no longer a medication, now it's a drug.
I see.
And from the research that I did for today, it could cause a coma, it could cause respiratory problems, and even death. And I think when we were talking earlier, you were talking along the lines in terms of the overdose problem.
Yeah, that's really a crisis. Now the number of overdoses in the United States actually exceeds the number of deaths in car accidents.
Wow.
And that happened already in 2011, I believe. So if you can think then of any disease like bird flu, or a new disease we haven't heard of yet that would kill 40,000 Americans a year, that would be an epidemic.
That's really something.
And if that were
Yes,
the
sir.
case, we'd be up in arms. Oh my gosh, we need to do something about bird flu.
We'd be up in arms.
Yeah.
No,
But it seems like we don't want to really address some of the simple issues, such as the abuse of cough syrup and over-the-counter medications.
Right.
And Jim, there's also, and I'd like Dr. Hess to maybe just touch on it, there's a thing called synergy. When people are mixing drugs and alcohol, you get a more intensified I guess high, I'm not sure of the right word, but would you just touch base on that a little
Right,
bit?
really, I mean, when you take prescriptions, you always worry about drug interactions, and you ask your doctor what would happen, if I'm taking these other medications for my blood pressure or cholesterol. And in the case Joe's referring to in Nora, they're saying that you're taking an unknown mixture of drugs and wondering what the outcome's going to be. What are the interactions? And usually it'll be more sedation, possibly an overdose, respiratory depression, low blood pressure. And if the stimulatory drugs like Adderall or Ritalin are involved, it could be hyperstimulation on the other hand. And in the most serious cases, winding up in emergency rooms, the number of emergency room visits for prescription drugs has increased to an all-time high in 2011.
Wow.
We don't have the data yet for 2012 because we're not finished yet, but it just keeps going up. A graph from the National Institute of Drug Abuse shows that the opiate overdose increase has gone up 4 or 5 times just in the past 10 years.
Wow.
And it's still going up. It's not leveling off. That's the concern, that it's going to continue to get worse.
I see. Well,
And
so,
can I just
yeah,
add, the
sure.
peak overdose deaths start in the teenage years, where there are actually twice as many overdoses from legal prescription drugs as there are from street drugs, illegal drugs.
Wow.
And that increases in disparity to the age of 45 to 54, at which point they have the highest overdose risk. And that surprised me, because these are people who go to their doctors, they have legitimate prescriptions, and yet still have overdose deaths. That's a real shock.
So it's become a public safety problem now, would you say, like alcohol is?
Yes,
Yeah?
and
Wow.
even to the extent of drug driving. It's not drunk driving, it's drug driving, because the drugs are in the system. And there's been a number of items in the news for people being arrested for driving under the influence of drugs rather than alcohol. And I'm sure accidents are related to that.
This is kind of like a philosophical question. Maybe you all could say something about it. What do you think is causing this epidemic of pill abuse? What do you think it could be? Is it a culture? You want to say something?
I'll be happy to start. I certainly have my views on it. I think that it's a societal issue, and part of it is an oversight issue. We give such really poor mixed messages about drug abuse, and we give poor messages about medical marijuana, and we do so many poor messages about alcohol abuse. And I think that what is confusing is that the medications are prescribed by a doctor, so people either think that it's okay because it's prescribed by a doctor, not realizing that it's being misused or used inappropriately, and it can be purchased. And so there's this message out there for people to think that it's okay because a doctor prescribed it. And the addictions, you don't know when your addiction's going to start, whether it's on your first pill, on your fifth pill, 2 weeks from now.
Right.
And I think that we've just created this message, and we need to re-educate our society about appropriateness and misuse.
Yeah. And Joe's right, the source of most of the prescriptions are doctors. And the majority of doctors are actually very careful and even worried to prescribe anything that's a controlled substance. But about 90% of the prescriptions for controlled substances are coming from about 10% of the doctors. And the other amazing thing that I was surprised to see was that the number of prescriptions that are given for opiates each year has gone up as well since 2000, to the point where now there's up to 7.75 million opiate analgesic prescriptions in 2010. It's just mind-boggling. 75 million prescriptions a year, and they're all legal because they're prescriptions. And as Doreen mentioned, people believe that it's a prescription medication, so it must be safe. And kids get that message too. Well, I see my parents taking it for their back pain, so I guess I can try it. It didn't hurt my parents.
Just watch TV. You know, you're not sleeping well, take an Ambien, take a Lunesta, and they got beautiful butterflies, and the marketing is wonderful for that. And that's just some of those pills. And then you see other medications that are being put on TV, and I think it really is sending a mixed message. The advertising has hidden persuaders in it.
Yeah. You know, when I was a kid, I remember growing up, we'd go to Jones's Beach, we'd go to Rockaway, and we get down with like a little cooler of beer, like we were 19 years old, and we had maybe 5 or 6 beers, right? And you'd have this bottle of beer to drink, right? Maybe 2 of them, and you'd be looking at all the beauty of the sea, of the sailboats, the people swimming. You enjoyed the day. You shared in conversation. I don't see how that evolved into a small pill to take for young people. How does that work? Where they go from the enjoyment of such, I'm not praising alcohol now, I'm just saying, you know, it's a beverage, you know, but at least you know what's in it, you know, it's so much alcohol. But these little things are so dangerous. Actually, you can't write things like that. You want to say something?
Well, I think it's, Jim, it's about availability.
Okay.
As we were saying earlier, most people get it from the medicine cabinet at their family member's house, mom, dad, grandparents, their friend's house, and it becomes a party. There's something called farming parties where kids go and they bring their pills and they put them in a bowl and they share these pills. And the danger of it, again,